Well, good afternoon, Canadian Caucus. I'm going to talk to you about nursing home litigation in Ontario since COVID. I've been on a very steep learning curve since April of last year. Before COVID-19, I'd never acted for a single resident of a long-term care facility. I've certainly learned a lot over the last 16 months. There isn't any doubt that we've failed our seniors. And this has been a problem of long standing. It's been a problem for decades. COVID-19 really just put a spotlight on the problem. COVID-19 started in Ontario in March of last year. Our firm started getting calls almost immediately into early April. I decided that a class action was the only viable means of getting justice for these residents and their families. We issued and served our first class action in April 2020, and that's when the phone really started to ring. Ultimately, we issued 15 class actions against 80 homes. Lundy Manor was the first class action. And that was a retirement home that decided it was okay to have a pub night for its residents on March 28th, 16 days after the WHO had declared a global pandemic. Orchard Villa was our second class action, and for a long time, it was the home which had the largest number of infections and the largest number of deaths, only to be surpassed by Tender Care in 2021. With 81 deaths. We then had the village of Erin Meadows, Erin Mills Lodge, and the village of Humber Heights, all homes owned by Schlegel Villages, a large chain in Ontario. Holland Christian Homes, which was one of the homes that the Canadian military went into and was subject to the Canadian military report, which came out in May of last year. Ballycliffe Chartwell, which is part of the Chartwell chain, a large chain of homes in Ontario with over 80 homes. Ina Graft and Gage home. Seven Oaks, which is a municipal home run by the City of Toronto. And Roslyn Retirement Home, which is to date the only home which has lost its license as a result of conduct since the start of COVID. The Craigley Nursing Home, which is part of the Southbridge chain. Sunnycrest Nursing Home, which was hit hard in the second wave, as was the Wexford Residence, as was the village of St. Clair, another Schlegel home. And then Southbridge Roseview, which is again a Southbridge home managed by Extended Care. So we've learned a lot since the onset of COVID, and I'm going to take a deeper dive into one of our homes, which is the Orchard Villa home. So before 2015, it was owned and managed by the LaFontaine family, and it was a well-run home, and it was sold to Southbridge Healthcare, a large American chain of homes in 2015, and Southbridge brings in Extended Care. Now, Extended Care has a very interesting history because it's a large multinational corporation which had a number of homes which they managed and owned in the United States before 2012. In 2013, the Department of Justice charged Extended Care under the False Claims Act, and the basis for the charge was they were providing services which were so deficient that they were effectively worthless. And the Department of Justice was claiming the Medicaid and Medicare payments that were made to Extended Care. In October 2014, Extended Care paid a $38 million fine, which was a record fine under the False Claims Act at the time. Within a couple of weeks of that, Extended Care sold its American portfolio for $870 million, and they said they were taking that money back to Canada And they then started buying up a number of homes in Canada, mostly in Ontario. And Southbridge hires Extended Care, who they describe as a recognized leader in the healthcare industry and managing of nursing homes. So they take over in 2015, and what happens? The level of care almost drops immediately. The homes, our residents who had been there since before 2015 noticed a dramatic decline in the level of care. And the number of investigations, this home was investigated over and over again. There were 19 investigations by the Ministry of Health and Long-Term Care, who spent 43 days investigating complaints. There were 65 written warnings, a number of plans of correction and compliance orders and referrals to the director. Now, we issued the claim against Southbridge on May the 24th. The claim was served on May the 25th. On May the 26th, the Canadian Forces released its report and was reporting on the level of care at Orchard Villa. I still remember Doug Ford's press conference. He was almost tearful when he was describing the events at the nursing homes. He described them, the facts, as heartbreaking and gut-wrenching. He was appalled and disgusted with what was occurring in these homes. And he promised Ontarians that there would be a full investigation. The coroner would investigate, the police and the Crown's office would investigate and take whatever steps were needed. So we were expecting great things in Ontario. And of course, by the fall, what happens? Well, Doug Ford also promised accountability and justice for the residents and their families. So by the fall, there were no charges. No one had been fined. No one had even lost their jobs. And Ontario introduces Bill 218, which shields wrongdoers from responsibility for negligence. And Doug Ford indicated that they had consulted widely with the industry before that, but they didn't consult with any residents or their families, and they didn't consult with any consumer advocacy groups, but they did consult with the Insurance Bureau of Canada and long-term care homes and their lobbyists. And here's a chart showing many former Conservative premiers who are now part of the long-term care lobby. Many top bureaucrats in Doug Ford's government are now paid lobbyists for the long-term care industry. So in terms of where we are in Ontario, the status of the class actions, 8 law firms started class actions against long-term care homes. Many of them were overlapping. 2 firms sued Ontario, and all of the cases ended up in front of Justice Belababa, who encouraged counsel to sort out the issues in the litigation amongst themselves in a manner to avoid carriage battles. And the law firms involved in the cases against the long-term care homes did manage to work out a plan to bring forward litigation for all the residents. So that was done. There are now 8 class action groups. There's the group against, consolidates all the actions against Sienna. There's a second group with the Rivera long-term care cases, a third group with the cases against Chartwell, the fourth group against the Responsive Group, fifth group against Extended Care and Southbridge, Group 6, all actions against Schlegel Villages, and then all single operator homes are part of Group 7, and then the municipal homes are part of Group 8. So that was all worked out. And The carriage, there was a carriage motion between Koski-Minsky and Roshan-Genova with respect to the claim as against Ontario, and that was heard on April 16th. And Roshan-Genova was granted carriage of that class action. So the other big thing that's happened is that on April 30th, Justice Morocco released the report on the long-term care industry in Ontario. And it was a devastating report, a devastating indictment of Ontario and the long-term care industry. The infection and death rates in Ontario long-term care homes were among the worst in the world, over 4,000 deaths and 11 staff deaths. Justice Morocco went back and reviewed the previous reports after pandemics. And remember, we had the SARS epidemic in 2003, which involved 44 deaths, 300 infections and 44 deaths. And there was 3 reports that came out of the SARS epidemic: the Naylor report, Walker report, and the Campbell report. And all of these reports basically say you have to be prepared for pandemics. And Justice Campbell said this, and it was quite prescient: if we don't learn from SARS and do not make the government fix the problems, we will pay a terrible price in the next pandemic, and surely we have. So what was known, the other thing is that we had advance notice in Ontario. I mean, the pandemic did not start in Ontario, it started in China. And that was reported at the end of December 2019. It spread then to Thailand, South Korea, and Japan in January, and that was known. The first Toronto man was diagnosed on January 25th. We knew about an outbreak in a nursing home in Washington State in February, and we knew, of course, about the Diamond Princess COVID outbreak. We knew about Italy having a major outbreak in February, and there was time to take steps in Ontario and the rest of Canada. But Ontario did not respond appropriately. The government was still saying in March that the threat of the virus was low and it was related only to travel. So it was only a matter of time that we had major outbreaks in Ontario. The first in a long-term care home was March 16th. And the virus then just raced like wildfire throughout the industry. There were numerous infections starting in early April, and then numerous deaths following. The one thing we know is when it comes to any pandemic that speed will trump perfection, and you have to take action once you know about a threat, because if you wait to figure out everything, the virus will overcome the means to contain it. So that is a lesson that we've learned over and over again, and it goes back to Justice Horace Creever, who reported when he reported on the Canada's tainted blood crisis in 1997, that you don't have to require proof of causation beyond a reasonable doubt before taking action. You have to take action immediately, and that was not done. It should have been done. And there were so many lessons that we had from past pandemics that we didn't fully heed, and the result was unmitigated disaster in the long-term care industry. What happened in Ontario was that Ontario didn't have an emergency stockpile when COVID-19 started. Now, they had it prior to that. Back in 2014, they had an emergency stockpile, and that lasted until 2017, and then they realized it was almost entirely expired. In 2019, Ontario orders the destruction of the emergency stockpile, and it was never replaced. Secondly, there was no plan. There was no emergency plan, and they made up the plan once COVID-19 started. Many of these homes didn't have IPAC procedures, And once the virus got inside the homes, staff got sick and staff became fearful of coming into work. And in many of these homes, there was an 80% collapse in the level of staffing without any plan to replace those staff members. So the other thing about what has occurred is that it really is a matter of common sense. You don't have to have a medical degree to figure out what is required in the event of a pandemic. There has to be a plan to isolate residents. We have had so many family members come to us and say they knew that their loved one was in a ward-style home where one of the other members of the room contracted COVID, and they questioned the staff and the management of the home about why that person was not isolated. And the response they often got was, well, there's a plastic partition protecting the other residents of the room. And of course, that's nonsense. And a matter of common sense would have been, you have to isolate people with COVID-19 and prevent the spread. But that common sense was not there. And unfortunately, many people got infected and ultimately died. So hopefully there is a lesson in this for future pandemics. We can't do anything about what has happened in the homes up to now, but there's lessons for the future if they're heeded. And with that, I'm going to turn it over to Clint, who's going to tell us about nursing home litigation in Alberta.